Good evening, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD. This is a Lyme disease webinar where you get to ask questions to help sort through this thing called Lyme disease. Hopefully, with some of the questions you have tonight, you'll get some insights about ways that you can improve your care. Usually, I'm able to answer most questions. Every now and then, you stump me, and sometimes you give me new ideas. So please ask questions, no matter whether you think they're good or not. Usually there's something that everyone can learn from your question, and sometimes I even learn a few things too. So the way that these webinars work, you create them, and you create them with your questions. And over here on the bottom right-hand side of the screen there is a chat box. Write your question to me through that chat box. As you're writing the question, please do not hit the enter key until you're done with the whole question. And the reason is each time you hit the enter key, it sends a question to me. And it makes it easier for me if I can see a whole complete question from my side as I'm posting it up, and so that I don't have to chase around different parts of your question as I'm displaying these questions during the webinar tonight. So during the webinar tonight, I am going to post those questions on the screen. I will read them, though, even as I've posted them. And the reason is sometimes in the recorded version of the webinar, it's a little difficult to read the question, so I'll make sure that people can hear that question too. And so, yes, I am creating a recording of the webinar tonight. And if everything goes as planned, I will post that recording tomorrow morning. For those of you that have signed up for the webinar, you'll get an email from me somewhere around 6:30 a.m. Seattle time in the morning with information about where to see that webinar. If you happen to miss that email, the way you can find the webinar is look on the webinars page at treatlyme.net. You can also find it on the homepage of my supplement store at treatlyme.com. And then it's also on my YouTube page. And I will also put it on my Facebook page. And the Facebook is Facebook.com/treatlyme. Okay. So those are many ways that you can see a recorded version of the webinar tomorrow morning. All right. So let me start looking at where our questions are here. And I'm going to go ahead and post the first question up. Hello, Kumar. Let's see. Recent Lyme relapse with migrating pain and fatigue. Currently on month 3 of treating with Japanese knotweed, teasel, turmeric, ashwagandha, and cowden herbs. A new symptom appeared last week, tightness in the base of the skull. Is this something you've seen before? Will tetracyclines help with this? Also, persistent heaviness in the throat. Any insight is appreciated. All right. So, Kumar, a couple of things. So, the one thing that's very unique to Lyme disease and very peculiar to Lyme and not really to other illnesses is this having wandering symptoms. So either wandering neuropathy or wandering joint pain or wandering muscle pain. It's very particular for Lyme. Dr. Horowitz, Richard Horowitz, out on the East Coast has been doing some studying about a Lyme disease questionnaire that he's been perfecting, the Horowitz Lyme questionnaire. And he's looked to see what of the questions he asked in there are the most valid for having Lyme. And it appears that the questions about migrating pain, migrating neuropathy, that they're so specific for Lyme that if you have it, it's pretty much equivalent to having a positive test saying that you have Lyme. Okay, so it's very simple. It's very much consistent with having Lyme. So the first thing I always want to know when somebody gets symptoms returning, my first question is it Lyme? Okay, and so I think with the nature of the way you described it, it is. But I will raise one issue with you. So when you've been on antibiotics, either herbal or prescription antibiotics, at some time to treat Lyme, even if it was a year, 2 years ago. After you stop those herbs or you stop those prescription antibiotics, you remain a setup for developing too many yeast growing in your intestines. So how the heck does that relate to this? Well, the way it relates is when you have Lyme disease symptoms, the reason you feel poorly is that white blood cells in your immune system are trying to get rid of Lyme, overproduce a group of chemicals called cytokines, okay? And it's cytokines that give you brain fog, make you hurt all over, give you wandering pain, etc. I can go through the whole list of Lyme disease symptoms. The majority of those are actually excess cytokine symptoms, okay? Now, Yeast growing in your intestines also trigger the immune system to make too many cytokines, okay? So if you're set up for having too many yeast and they start growing too much in your intestines, that causes the immune system to make too many cytokines, and it can look like a Lyme relapse, right? So the reason I asked you to consider that in your situation is that throat symptom that you're having of heaviness in your throat sometimes can be part of what yeast would look like, all right? So consider if you have yeast. And so here's some questions to take a look at. Number one, have you been having any increased sugar cravings? Number two, do you have any increased intestinal gasiness or bloating? Number three, if you're a female and with a name like Kumar, I don't think you are, but if you are, but if you happen to be a female listening and you're wondering about this, do you have vaginal itching or vaginal discharge? And then the fourth thing I often will consider is if a person has worsening rashes or increasing pimples or acne. Yeast release and toxins in the intestines get absorbed into the bloodstream, interact with the skin that can make skin rashes worse and can bring on acne or pimples, okay? So if you have a number of those, Kumar, then you might actually want to treat for yeast as well, which could be contributing to the kind of problems that you're having, okay? All right. The other thing that you might consider doing for that occipital pain, that pain back here tends to be something we can see with Lyme, is you might want to use some magnesium. Sometimes magnesium will help the muscles relax. And the way I would use that magnesium is I take about 400 to 600 milligrams of magnesium at bedtime, okay? That can sometimes help. If you take too much magnesium, just be aware you might get some diarrhea from that. If you do, back it down. But 400 or 600 milligrams of magnesium is also very helpful for getting to sleep, okay? Can tetracyclines help? Yeah, I mean, tetracyclines are anti-inflammatory. They also are germ killers that would help along with the teasel to kill your Lyme. And you mentioned the cowden herbs. I don't know which of the cowden herbs you're taking. If you're taking Toba bark, which is the banderol, or if you're taking cemento, cat's claw, and you were to add beyond teasel and then add tetracyclines, that sometimes can help with the Lyme symptoms as well too. And then keep in mind with any antibiotics generally are also anti-inflammatory. Okay, so they sometimes can help with the pains too. Although when you add an antibiotic, be aware you might trigger a Herxheimer reaction, which means the immune system sees all those dead bug parts and makes more cytokines. Okay, all right. In terms of pain control, your knotweed that you're taking and the turmeric are both anti-cytokine. They help lower those cytokines that are giving you your pain. One other thing you might want to consider is adding in some glutathione to this. I would do a liposomal variety of glutathione. A product I like for that is a product by Research Nutritionals called Trifortify. So liposomal means it's microscopically wrapped in fat to increase absorption. The reason you might want to add glutathione to this regimen is it will help the liver to remove toxins that might be building up, triggering cytokines. It also is a very strong antioxidant that helps lower oxidizing agents that are telling your white blood cells to make cytokines, okay? The knotweed, or at least the turmeric, gets inside of the white blood cells and tells them to stop making it. And what the glutathione would do is it decreases the chemicals, these oxidizing agents that are telling the white blood cells to make cytokines, okay? All right, so anyway, those are some thoughts for you. Good luck to you. Thank you for that question. Hello, Thomas. Let's see. Hope you're doing well, Dr. Ross. Yes, I am. I'm a little tired today. I had a very long day. I just actually ended my patient care day right before I opened up the webinar tonight. So we'll see how this goes. I'm actually wondering if I may even stop the webinar a little bit early tonight, just because I am just feeling kind of worn by the day. But other than that, I'm doing pretty well. Let's see. We are not sure if I have Babesia, but have had some symptoms which may appear to be related to it. I recently started taking Cryptolepis, and each night since I wake up feeling really warm and have slight sweating. My pulse is faster and I'm breathing harder. I guess there's a second part wandering around here, Thomas. Let me see if I can find it. So, Thomas, unfortunately, the second part to this question didn't show. But if your question is, could killing Babesia with cryptolepis make some of the Babesia symptoms a little bit worse at first? The answer is yes. And so, yes, sometimes when you get on a Babesia germ killer like a cryptolepis or a Malarone or artemisinin, cryptolepis is an herbal way to kill Babesia. Artemisinin is another herbal way to kill that. Sometimes you'll get increased sweat. Sometimes you'll get increased air hunger. And sometimes you'll see heart symptoms like racing or skipping of your heart might get a little bit worse too. So if your question was, could this be from killing Babesia? Answer is yeah, it could be. Okay. All right. Go back here. And thank you for that question. Let me see if they posted a second part to that. Oh. All right, let's see here. I want to do a quick screen share here for a minute. Called Treat Lyme, and probably for the next 1 or 2 weeks, this is what it's going to look like. I've been telling people for weeks that I'm having this redesign, and it seems like the redesign project that is never going to end, but we're actually getting close. I think there'll be a more workable version of the website launching hopefully within about the next 2 weeks. We'll see if that works out as it's supposed to. Anyhow, in terms of options to treat Babesia, I just want to show you where you would find information about that. Take a look in chapters, look at the infection treatment plans tab here. And you want to look down at the article called, where are you? Well, somewhere here. There it is. It's this article called Kills Babesia, Brief Guide. In here, I review with you how to use cryptolepis, how to use artemisinin. I also review various prescription anti-parasite and anti-Babesia medicines that you can use. And I talk about how to build a Babesia treatment, all right? So take a look at that article for more information, okay? All right, let me go back here. All right, let's see here. Hello, Gloria. Let's see. So grateful for you, Dr. Ross. Thank you. Thank you. Since some of us experience relapses of Lyme, does it make sense to take the herbals like cat's claw or toba bark every now and then just for prevention? It's a good question, Gloria. So I have a whole article on what to do to prevent a relapse, okay? And I think what might be useful is if we just take a look. Well, actually, let me talk about it, and then I'll show you where it is for more information. All right. So when somebody has had Lyme in them for a year or more, and that's when we start treating them, okay? If it's been in them for a year or more, most of us that treat Lyme do not think that we ever get rid of every germ, okay? If Lyme has been in you for a year or more, it's very hard to eradicate it. The best that we're doing with antibiotics is to knock it down under control, so hopefully the immune system will keep it under control, all right? So at the end of treatment, when you're doing well, the things that I like to do are to target ways of helping your immune system to keep the germ under control, all right? And so what those things are number one, get sleep, okay? Get 7 to 9 hours of sleep a night. That helps support the immune system. Number two, try to exercise, but try to find a level of exercise that doesn't knock you down, okay? So exercise to tolerance, all right? So exercise stimulates the immune system, okay? Number three, deal with stress and emotional toxins in your life. Yeah, emotional toxins, because that kind of stress, the emotional toxins suppress the immune system, which makes it easier for Lyme to get active again. Number four, eat organic food as best as you can, all right? Now, I know they're more expensive, but if you can afford to, eat organic food. Don't put poisons in, all right? Number five, be on an herb or a supplement that stimulates the immune system, all right? So one way you can do that is to use mushrooms. So for instance, I like using an herbal mushroom mix called the Immune Builder 5 Mushroom Formula. It's by a company called JHS Naturals. And I'll have a person take one pill of that 3 times a day. That's one way. Another thing you can do is use something called transfer factors and use a product called transfer factor L+. Transfer factors are proteins that are made by white blood cells that detect infection, and they are sent over to the white blood cells that are going to fight the infection. And they tell those white blood cells that are going to fight the infection, or the army, what infection they're supposed to treat, so they grab the right equipment to kill those germs, okay? So they target the immune system, okay? So Research Nutritionals makes a transfer factor mix called transfer factor L+, that has transfer factors in it that include those against Lyme and the co-infections. And so you could take that as one pill twice a day too, okay? All right, so there's some minimal things I'll do, okay? Now, if I've got a patient that has done that, but then they relapse easily, like almost right away, or they're in, so what I might do first is to try to just have a person do the basic program. But if they get into a relapse situation, or if they relapse quickly, then when I finish treatment with them the next time, I'm going to be inclined to talk with them about doing all those things I already talked about to boost the immune system, and being on a antibiotic or herbal antibiotic to suppress the germ, to kind of keep it down, to swat it down as it might pop up, okay? So a way that I might do that is I might have somebody use like an Otoba and a cat's claw, and I might have them do, instead of 30 drops twice a day, I might have them do 15 drops twice a day, or I might have them do it just once a day. Sometimes you can do this with lower doses, okay? Or I might use prescription antibiotics, so like a clarithromycin Biaxin that you can use to treat Lyme, usually has 500 milligrams twice a day. When I'm using it more to suppress the germs, to keep them from popping up, I might do it as 250 milligrams twice a day. I might do it as 500 milligrams once a day, okay? So yeah, you could use antibiotic herbs or antibiotic prescriptions as part of a program to help prevent a relapse, but you also got to do everything else to support the immune system, okay? So if you want to read more about this, let me just do a quick screen share. Yep, relapse right there. Okay, so in my relapse chapter, I have an article on how do you what transfer factors do. And then the main article that I have people look at that describes what to do at the end of treatment is this one called Finished and How to Prevent Relapse, okay? So take a look at that. You'll find lots of useful information in there about the steps you take to prevent a relapse. Hello, Craig. Let's see. Had long mold exposure, given bentonite clay, zeolite, charcoal, no change in symptoms. Real-time mold test shows ochratoxin was 18.3, gliotoxin was 9.7. Started on Dr. Klinghart's detox program of zeobine, metal sweep, cilantro, chlorella. No meds given. Will this work? Thank you so much, Dr. Ross. It could. I'm not as familiar with what is in the zeobind. I generally do not think cilantro and chlorella are good toxin binders. I don't know why Dr. Klinghart uses those, but they're very, very weak at pulling toxins out. In terms of the ochratoxin and gliotoxin, these are both mold toxins that can come from wet buildings. There's a variety of mold that make the gliotoxin. In fact, yeast living in us can make a gliotoxin too. The ochratoxin tends to come from a mold fungus found in wet buildings called Aspergillus. In terms of what can work well for those is a bentonite clay should work well coupled with activated charcoal, okay? And I see that on your initial plan that bentonite clay and charcoal is what you were using, all right? Now, if they're not getting better, it can mean one of two things. Number one, you didn't take enough, all right? So generally with bentonite clay or an activated charcoal, those come as 500 milligram pills. I'm usually going to have a person work up to taking it 3 times a day, and I might start it work to initially 500 milligrams 3 times a day, both of activated charcoal and of the bentonite clay. And I might eventually even work up to 2 or 3 of those 3 times a day, okay? All right. Now, one thing that can sometimes happen when you're detoxing, if you're following what's happening with your toxins with real-time labs, okay? So Real Times, everyone, is a lab down in Texas that does a urine test to see if you're peeing out excess mold toxins, okay? And sometimes as you start to do your initial detox work, you'll find that those toxin levels go up even 2 months, 3 months after you've been detoxing. And so one of the reasons that it's postulated, or we think that that could happen, is when you have a lot of excess mold toxins in you, the kidneys have a hard time even peeing out those toxins, okay? And that as you get less toxins in you, the ability for the kidneys to pee out the toxins improves. And so you'll start seeing higher levels of those toxins sometimes at the beginning. Now, the only way to really know if you're worsening is if you feel worse, okay? So if you've got toxin levels going up 2 or 3 months down the road and you're feeling worse, then that probably means you're still having mold toxin issues, okay? Or that they're worsening, okay? So why could you have worsening mold toxin issues? One is you may still be being exposed. So you got to make sure that you're not having exposures either in your work or home environment. That may even mean getting some inspectors in to make sure you don't have continuing mold exposures, okay? All right. The other reason that you can sometimes have worsening mold toxin problems as you're treating is if the problem is that you may actually have mold that is colonized living in your nose passages and in your intestines, acting as a toxin brew pub, producing more mold toxins, okay? The trouble is we don't have good tests for that. So sometimes if I'm treating somebody and I'm pretty sure their home is clean and their work environment is clean, I've been detoxing them for 2 or 3 months and they're still worsening, it's at that point that I might start putting them on mold killers, medicines they would take, a nose spray, as well as pills to start cleaning mold that might be colonized out, okay? All right, so where can you read all about this mold toxin issues, how to find out if you have mold toxins, how do you treat mold toxins, which mold toxin binder is best for which toxin, what would I use to actually kill those mold? Let me show you the article you can take a look at later. So yes, I have written an article about it. Let's do a quick chapter. And the first article there right now is this mold and Lyme toxin illness. Take a look here. I review each binder, trying to tell you which one works best for which mold toxin. I describe what are the best tests to figure out if you have mold toxin illness, including a review of the real-time labs. And I talk about what things you can use to kill mold if it is growing in you, functioning as your own brew pub, okay? Hello, Susanna. Hello, I'm 75 years old. Thank you for letting us know. That's let's see, I've had Lyme for a long, long time. Does it take longer to heal at my age? I get depressed over flare-ups. I'm starting in a regimen of antibiotic shots 3 times a week, 4 days off. Do you find this regimen works to clear chronic Lyme? So your age, I don't find that 75-year-olds have any less chance of getting well than somebody that's my age in my mid-50s or somebody that's in their 30s or 40s, okay? Now, compared to maybe a teenager or a kid, you're going to not get well as easily, okay? Because teenagers and kids generally respond fairly quick. I said generally, on average, okay? But no, I don't think that that necessarily is an impediment to you getting well. Okay. Now, in terms of the antibiotic shots 3 times a week, 4 days off, I would need to be able to answer that question. I would need to know what the specific antibiotic is. Is it something called bicillin, in which case 3 times a week is adequate? Or is it something called ceftriaxone, which maybe that's adequate? I would need to know more about the antibiotic. Secondly, I hope in addition to doing injectables, they're also having you do some oral antibiotics. And that is because the injectables are good for treating spirochete Lyme, but generally, actually, all the injectables I'm aware of do not treat for intracellular or cyst Lyme. Okay, so keep in mind the Lyme germ exists in you in 3 different forms. All right? And each one of those forms has the ability to morph into the other form. So Lyme lives as a spirochete. That's the thing that looks like a corkscrew. You can see pictures of it on the internet. Lyme also lives inside of cells. That's called intracellular Lyme. And Lyme also can form microscopic cyst. All right. To treat all 3 forms, generally going to need to be at least on 2 antibiotics. So even though you're getting injections, IV antibiotics 3 times a week, if they're only doing 1 IV antibiotic, that may not be enough for you. Okay. All right. Suzanne, so for more information about that, I'm going to do a quick screen share here. Oh. You can read without a subscription. Take a look at the article called A Lyme Disease Antibiotic Guide. In here, I talk about what you need to do to build a treatment to treat Lyme. And one of those things I said is combine antibiotics to treat all forms of the Lyme germ. And if you're looking at what the various kinds of antibiotics are that we can use, I list them all here in part 2. And then down here in part 3, I actually give you some sample treatment regimens that you might consider using. Okay. So it's a good review article, and it's one of my free articles as well, too. Thank you for that question. Hello, Lori. Does liposomal glutathione put your liver in overdrive? I keep hearing this, so wanted to check with you. Wondering if capsules are as good as Fortify. So I don't know what people mean by overdrive. What it does do is, so first of all, glutathione is a chemical that is made in every one of our cells in the body. Okay, so it's produced in every cell. It's used in every cell to repair cell damage. And in the liver and in the brain, it's made actually in high concentrations. And specifically in the liver, it's used as one of the chemicals that helps to detox. Okay, so it's what our liver uses to help remove fat-based toxins. I don't think you can give too much of it. Okay, so I don't agree with that idea of going into overdrive. I'm not sure what people mean by that. In terms of the, excuse me, it is allergy season for me here in Seattle right now. So in terms of the forms that glutathione comes in, so you want to get it in a liposomal variety. That means it's been microscopically wrapped in fat to increase absorption. Okay, one version of that is Trifortify Orange and Trifortify Watermelon by Research Nutritionals. They actually have research that shows that it does increase cell levels of glutathione. Okay, they actually have published research about that. There are other companies that will make liposomal glutathione in a pill. So, for instance, Pure Encapsulations makes a liposomal glutathione in a pill. I'm okay with people taking it in a pill too. So whatever formulation works best for you. The key thing is make sure it's liposomal so it does get absorbed. The trouble is regular glutathione that's not microscopically wrapped often will get destroyed in the stomach before it gets absorbed in you to actually do meaningful things. Okay? All right. Good luck to you. And thank you for the question, Lori. Let's see here. Hello, Craig. Let's see. How dangerous is an 18.3 ochratoxin level? They say it is systemic, especially in the brain. So, ochratoxin, I think the published levels on the real time is supposed to be 2 or less. I'm just saying that off the top of my head. So 18 is significant. Whenever you have mold toxins in you, they're in the blood and they're circulating throughout the body, even at lower levels, okay? So in the blood, they're going to circulate up to the brain, and they're going to circulate through all your tissues too, all right? So I don't know if that level is any more dangerous or harmful than any other level that's elevated. You may have more symptoms from it, but it can be dealt with by doing the binders that we talked about earlier, okay? All right. Good luck to you, Craig. Hello, Dawn. Let's see. Can Lyme or co-infections cause worsen post-traumatic stress disorder nightmares? Yeah, it's possible. So Lyme and Bartonella especially can sometimes trigger psychiatric issues or psychologic issues. And sometimes that can mean it can worsen underlying psychologic or psychiatric issues, okay? So it's possible that by having Lyme or a Bartonella co-infection, that some of the psychiatric problems that a person might have might also worsen as a result of that. Thanks for the question, Don. Hello, CJ. Let's see. Thank you, Dr. Ross. What is your opinion on stem cell therapy for neuroborreliosis? Do you recommend a certain type of stem cell? All right. So I got to just tell you, stem cell therapy, the jury is out as to whether it is going to be something useful for Lyme or not, okay? So stem cells, everyone, are the most rudimentary form of cells in the body. They can grow into anything. So for instance, if you put stem cells in the knee, it can grow into cartilage. If you have an immune system that's not working well, you can get more healthier and new immune system cells. If you happen to have nerve injury from Lyme, stem cells may help repair those nerves. Okay, that's the idea behind stem cells, for instance. Okay, all right. Now, the trouble is, and although there is a growing body of knowledge that says that yes, this is good for doing tissue repair, like knee problems, cartilage problems, things where you can inject it locally and get a response. We really don't know yet whether this is going to be helpful for Lyme. I honestly don't know either. I do think it's a therapy that probably does best at rebuilding tissues. There's some evidence, for instance, in the world of multiple sclerosis now that doing stem cell infusions can help with that too. The trouble is we don't know how many are needed, and nor do we really know in Lyme if it works. No one's published studies yet to say about that. What I can tell you is that the LymeDisease.org, which used to be formerly called the California Lyme Disease Association, has been doing a data gathering project called MindLyme Data. And basically they contact people that agree to be contacted, ask them a question, and then they get responses back, okay? And so in their data bank, at least in, the International Lyme Associated Diseases Society, ILADS, had its annual meeting in November, and Lorraine Johnson from LymeDisease.org, who has been the leader in this Lyme data project to learn things from patients based on their own information, presented some stuff that they've learned from their database. And one of the things she did present was information about stem cell research. And in their, what they've gathered from their patients, about 10% report improvement from doing stem cells. 10% of those that have had stem cell therapy report improvements, okay? So that would suggest maybe this isn't a big thing, okay, that it's gonna make a difference. Now, the trouble is I'm very doubtful if a person just gets one treatment that it's gonna make a difference. I think if stem cells are going to work for a person, you're gonna have to have multiple treatments or infusions done over multiple days or maybe over multiple months, all right? So we just don't know what is the right amount. But at least if we look at some of what California Lyme has put up, or LymeDisease.org has put up, it doesn't support this as being the big treatment that's going to change it for people. And I will also tell you that I've had a number of people who have gone for it, and I'm just not seeing, on average, the greatest results out of it too. Okay? All right. So, but I would also say the jury's out. I honestly don't know yet. In terms of what's the best kind, I don't know. I mean, again, no one has done research to be able to tell us what is the best kind on this. Okay? All right. Good luck to you, CJ, and thank you for that question. Hello, Brenda. Let's see. Thank you, Dr. Ross. Are you still recommending wildcraft herbs for herbal antimicrobials? I have Lyme and Bartonella. What herbal antimicrobial protocol would you recommend if I can't take Cemento? Also, what are the best herbs for leaky gut? You snuck a number of questions in there. Okay, Brenda. So yes, in terms of herbal antimicrobials, herbal antibiotics, I have moved away from using products made by Nutrimetics to using products made by Wildcraft Herbs. I did that for a couple reasons. Number one, Nutrimetics has decided to only sell their products through their own store, and in so doing, basically jacked up their rates. So it became very expensive for my patients. And so I started looking for other sources. And so I came upon Wildcraft Herbs. They're manufactured up in British Columbia. And I talked extensively with the person that's manufacturing these. I think they're a stronger herb, actually. So first of all, I think she's using about twice as much plant in her extractions as what Nutrimetics does. That means there's going to be more active chemicals, if you will, in the liquid portion of the herbs, okay? And then secondly, when she does her extraction, so extraction means you take the herb like a cat's claw or Otoba bark, you put it in a liquid, and then that liquid draws out the active chemicals, all right? So it's alcohol is what is generally used. That's what Nutrimetics does. That's what Wildcraft Herbs is using. She's using a higher content alcohol extraction, which is going to get more active ingredients too. And so far on to date, I think it's a slightly stronger formulation. I haven't changed the way I recommend using it. I still recommend using it at working up to 30 drops twice a day of the Otoba, 30 drops twice a day of the cat's claw, 30 drops twice a day of the Hutania, and Siddha Akuta. I still recommend it the way I used to use it. Now, Siddha is not made by Nutrimetics, but Siddha Akuta is another herb you can use for Bartonella. Buhner Herbs recommends that. And Siddha, I still recommend taking a quarter drop, or starting at a quarter teaspoon and working up to a half teaspoon 3 times a day. Okay, so even though I think the Wildcraft Herbs are stronger, I'm still dosing them the same way that I did with the Nutrimetics. Okay, I haven't found a reason not to dose them the same way. All right. In terms of what to use to kill Lyme if you can't do Cemento. Okay, so everyone, you may know that my favorite 2 herbs to kill Lyme, and this is based on practical experience of using them over the years, but also based on initially on some Petri dish experiments that got published showing that they work really well. And that is to use Otoba bark, which Nutrimetics calls Banderol, and to use cat's claw, which Nutrimetics calls Cemento. Okay, now Wildcraft Herbs sells them as cat's claw and sells them as Otoba bark. Okay, all right. So, but those 2 herbs on the Petri dish experiments that were done about 6 years ago, those experiments showed that those 2 herbs together do a great job of killing all 3 forms of the Lyme germ, removing slime layer called biofilm that covers the germs and can block out treatment. Okay, and so that's why I started using them. And what I find is those 2 herbs together work 90 to 95%. I'm sorry, 85 to 90% of the time. That's as good of a chance of working as prescription antibiotics. Okay, all right. Now, sometimes people cannot take Cemento or they can't take the Otoba. They get reactions to it. In which case, what I usually will do is I'll still stay, in this case, I would still remain on the Otoba, but what I would do is add in an herb called teasel, or teasel root is what it's called. And that also comes as a liquid tincture. And I would take the teasel and I would start at 5 drops twice a day. And then I would increase it by 1 drop per dose every other day until you reach 30 drops twice a day. You can take it directly at the same time that you take the Otoba bark. You can take them both together, okay? And that teasel we have here, it's a product called Spironil. I also know Wildcraft Herbs has their own. I haven't transitioned that one over because I can still get the Spironil at this point. But that would be a way to do that, okay? All right, then, terms of herbs for leaky gut. All right, so everyone, what is leaky gut? Well, many of you may know about it, but let me just kind of try to explain it here for a second. So, actually, I think what I'm going to try to draw a picture. Bear with me here while I try to draw this picture. Okay, now I'm not an artist. I sometimes get to play one in my office though, okay? All right, so this is, what I want to try to show you is, this is a drawing of what I'm going to call the intestines, okay? All right, so this inside area here is basically where your poop and your undigested food sits. This is one side of the intestines. This is the other side. I didn't draw this part out, but I did draw all this side out, okay? All right, so let me explain what this is. So this is inside of intestines. These are cells that line the intestines. This is a blood vessel down here. And all these little dots, those are immune cells, okay? All right, so 60 to 70% of the body's immune system lines the intestinal tract, all right? And that's what those little dots are meant to represent, okay? Right. Over here, this is healthy intestines, okay? In healthy intestines, you've got good bacteria in here, and you've got cells that touch up against each other very tight without any gaps. What happens is acid and enzymes that are made by the body, along with bacteria, digest, eat up food into small and small particles to the point that they then get absorbed to the inside of these cells, and the cells pass them through. They get down here to the immune cells, then they work their way into the blood system, okay? And because there are no gaps between these cells, the only way that something gets into the bloodstream and gets to these immune systems is if it has been first filtered by these cells, all right? Now, if you get too many yeast, or you get parasites, or you get Lyme, sometimes these cells will plump up and pull apart. And that's what this is supposed to represent, all right? And then what happens is you get things that leak through here, and they hit all these immune cells, all right? So you get toxins coming through, you get partially digested food, so and so you wind up start having problems with having reactions to the immune system, okay? So in leaky gut, what can happen is as things leak through and hit all those immune cells, you start having allergic reactions, you start having more inflammation chemicals like cytokines produced, okay? So one of the ways that you want to treat leaky gut is make sure you got a lot of good bacteria in the intestines to help digest up that food. Okay, that's number one. So be on probiotics, all right? Number two, if you happen to have yeast, make sure you don't have too many yeast. If you do, treat them, because you've got to get those germs out of there. And what I like using to treat yeast these days is to, I usually like a product called Capri Plus, but that's out of production right now. So these days I'm using a product by Integrative Therapeutics called Phytostan. That's Phytostan. And I would do 2 pills twice a day on that. That has a number of herbs in it that will kill yeast, okay? And then in terms of repairing other things that you can do to repair that lining, I like people to be on something called L-glutamine. L-glutamine is a fuel source for the cells that line the intestines, and it helps them work better so they can heal back together, okay? And that usually will come as a powder, and you want to take somewhere around 12 to 15 grams of powder a day, all right? Now, it depends on who the manufacturer is, but that's often going to work out to being a scoop full of powder 3 or 4 times a day is what you would want to do for that, all right? The other thing I would do to get that inflammation down, be on curcumin. It's 500 milligram pill 3 times a day. And I would also like to have people be on a healthy yeast for the intestines called Saccharomyces boulardii. also called Sacro B, and that's 2 pills 1 time a day. Okay. And with all that, it may still take a number of months for your intestinal tract to heal up. Okay. All right. Good luck to you, Brenda. If you, I have written a whole article about that too. It's in the Treat Lyme book. I won't do a screen share right now, but there is more information I have about it too. Okay. Actually, no, let me just do a quick screen share here because I talk about doses in this article as well too. The stomach and intestines. All right, and this is the article that I've both written, and there's a video recording to it too called Leaky Gut Syndrome, a video treatment guide. Okay. All right. Good luck to you. Hello, Katrina. Let's see here. Hello, Dr. Ross. Any advice in the treatment of my eye-related Lyme problem? Pain, swelling, cloudiness, and vision loss. And if one has late-stage Lyme, what can be done? I was just diagnosed with Borrelia and ehrlichiosis. Thank you. Bear with me. I just want to read back through that again. So first of all, Katrina, with those kind of changes, I would make sure you have an eye doctor take a look at that eyeball and make sure there isn't anything else besides Lyme that may be giving you those problems. Okay, so I would start by doing an eye exam by a professional that they can use all of their instruments. All right. And number two, the treatment for these kind of problems, visual problems, would basically involves the same things you would do to treat Lyme. So be on your various antibiotics to treat all 3 forms of the germ. Make sure you get sleep. Basically follow my Lyme disease treatment guideline, the Ross Lyme Support Protocol. All of those steps that I outline in the Ross Lyme Support Protocol to help recover from Lyme, you should be doing here, especially with those eyeball problems. Okay? All right. So let me just show you everyone that. So I rewrote this about a month and a half ago. And it's much more, it's still easy. Tab. Okay. And this includes all the steps you should follow. And when I rewrote it here recently, I've made it so that you can actually print it up. So you can actually print a short version or a long version of it. But take a look here. I go through all the key steps that you should do during the course of a Lyme disease treatment, in addition to being on herbal or prescription antibiotics to get well. And even in here, I describe the herbal and prescription antibiotics that you should be on as well, too. Okay? All right. So that's a free topic area that I have. It's under my treatment protocol section. There we go. Trina, good luck to you. Hello, Dr. Ross. Let's see. Hi, Carl. Let's see. How are you? All right. Thank you. I'm using the nasal spray Flonase steroid for allergies. Once a day, 2 sprays each nostril. Is there any contraindications problem using this product with Lyme disease? Thank you for your work and research. You're welcome. I try to avoid using steroid nose sprays in Lyme unless there aren't any other options, okay? And so the steroids that they're using them to actually block the allergic reaction up in your nose. It's anti-inflammatory. And although it's being sprayed here in the nose, and most of it's going to stay around the nose, some of it is going to get absorbed through the blood vessels into the blood system and circulate throughout the whole body, where it can cause some minor suppression of your immune system, okay? Now, you're not going to get full-scale immune suppression the way you might if you took steroid pills or if you did steroid injections, but it still is going to be enough in some people. So I tend not to want to do that, okay? Other things you might consider to help block those allergies would be more natural approaches. And one of the herbs that does a great job of that is something called quercetin. It stabilizes a group of cells called mast cells. And inside mast cells are where histamines are made. So something you're allergic to lands on one of those mast cells, and they make and produce all their histamines, which then triggers the whole allergic type reaction. If you use quercetin, it stabilizes those mast cells to keep them from making and releasing those histamines, okay? So it's quercetin, 250 milligrams, 2 pills, 3 times a day. You might consider using that as an alternative to your steroid nose spray, okay? All right. Good luck to you, Carl. Thank you for that question. Hello, Andreas. Hello, Dr. Ross. I have terrible neuropathy in the legs, arms, and feet. Is that a Lyme symptom or co-infections? So neuropathy can be due to Lyme, or it could be due to Bartonella. Either one of those two can do it. If I've got somebody that I'm treating for Lyme and Bartonella, the neuropathy is not getting better, I'm also going to want to test for heavy metals to make sure that in their lifetime they haven't developed too much lead or mercury or other toxic heavy metals. Okay, so I would keep those in mind. Okay, so yep. And you can take a look in the Treat Lyme book to figure out ways that you can diagnose Bartonella. You can do it clinically. You can diagnose Bartonella clinically, see if you have enough symptoms to suggest Bartonella. You can find that in the How to Diagnose chapter within the Treat Lyme book. I also, in the detox section, there is an article on how to figure out if you have too many heavy metals. What's the best test for that? Take a look at that article as well, too. Okay? Actually, I'll just show you those real quickly here. Metals. Take a look at this article called Heavy Metals, the Problem and the Best Test. Okay, so I'd look at that. And then in terms of could you have Bartonella, in terms of figuring out whether you have that and whether you need to treat for it, look in the How to Diagnose chapter. And you want to take a look at my article called, here it is, this one called It Could Be Bartonella or Babesia, the Signs and Symptoms. Okay, take a look at that one. All right, and then finally, one thing I'm going to steer you to, although you didn't ask about it, you can do things to fix those damaged nerves while you're getting rid of the germs, okay? And there's a few supplements or a number of supplements you can use that will repair nerve damage. You want to take a look at my chapter called Brain and Nerves. Okay, and take a look at the article called Nerve Repair, Heal That Tingling, Numbness, and Pain. And the first thing I raise in this article is treat Lyme and treat Bartonella if they're there. Okay, I raise that, all right? But then also here's the additional steps you can take to repair those nerves even while you're treating the germs, okay? Some useful information to take a look at later, okay? And good luck to you. Hello, Zanetta. Let's see. Happy belated birthday, my LLMD. Well, I think it's been a bit of time since I've seen you, actually. Let's see. I'm sorry to hear of your struggles with your medical board. You're a true warrior and humanitarian. Thank you for all that you do. Thank you, Zanetta. I appreciate that. Would like to inquire about your knowledge and experience with Lyme and Babesia patients and low-dose naltrexone for chronic pain. Also, I think there's a second part here. Also, Z-Lyme and Babesia are back in full force, multiple other infections, getting no help from docs and specialists here in Vancouver Island. This that. I'm trying to see if there was another part here. No. Okay. Let me go back. All right. So, Zanetta, nice to see you here again. I'm sorry to see you here again. I'm sorry that things aren't going so well for you right now. In terms of low dose naltrexone, let me talk to you about what it can be good for. Okay. So naltrexone, everyone, is a narcotic blocker and an endorphin blocker, okay? So it's used actually mainly as manufactured for people that have drug overdoses and for people that have alcoholism. And the way it works is it binds to a receptor called the endorphin receptors, which happens to be narcotic receptors as well too. And so what happens is endorphins that we naturally make endorphins. Our bodies manufacture endorphins to regulate pain. Our bodies manufacture endorphins to regulate the immune system. Okay. Now, if you take and block the endorphin receptors with naltrexone, brain doesn't like that. And what the brain does is it basically sends out a bunch of chemical messengers to the cells that make endorphins, and it tells them to make more endorphins. And they do. All right. So when the naltrexone wears off, then those receptors get flooded with all these extra endorphins. And what that can do is it has the effect of regulating the immune system. It takes it so it turns down the inflammatory reaction in the immune system, and especially that type of inflammatory reaction where the immune system attacks you, okay, all right? It's specifically more of inflammation and pain seen in autoimmune illness, for instance, okay? All right, and so that is how it works. It basically causes you to have these surges, okay? Now, in terms of can it help in Lyme, well, what we do know, there's research that's been done looking at what it can help in, and it's been shown to help in fibromyalgia. It's been shown to help in Crohn's disease, which is an autoimmune condition, arthritic condition of the intestinal tract. And then it's also been shown to help in multiple sclerosis, okay? It has been shown. And there's some evidence, I think it helps in rheumatoid arthritis as well, too. I haven't seen anybody do research to say whether it helps in Lyme or not. My experience in Lyme is that it actually helps maybe about 10 or 15% of people. Not everyone, okay, but it can. And specifically because it's turning down the immune system attacking you, it sometimes can help with chronic pain, okay? So you might want to give it a try. If you're going to do the low-dose naltrexone, you want to make sure that you give it at least a 3-month trial. You want to start it at 1.5 milligrams one time a day. And you do that for a couple weeks, then you increase it to 3 milligrams a day for a couple weeks, then you go up to 4.5 milligrams, okay? Now, it has to be manufactured by a compounding pharmacy, and that is because it's made as a 50 milligram pill by the manufacturers, and a compounding pharmacy is going to need to turn it into smaller pills, okay? All right, now, in North America, many doctors have suggested that this has to be given at nighttime. What's interesting is the Europeans tend to give it all in the morning. I give it in the morning too. Not because I'm European, but because the reason I give it in the morning is I found that if you give it at nighttime, it tends to cause sleep disturbance often, can give you nightmares, for instance, too, okay? But often if you give it in the morning, there's no problems with that, okay? Now, the reason people used to think about giving it at nighttime is there's a natural surge in our endorphin levels that happen in the morning. Okay, so what they were hoping is if you gave it at night, which caused greater endorphin production, that would build on the morning endorphin surge that already takes place and get a super surge, okay? The reality is it doesn't make a difference in the end of how it works. And in fact, the Europeans have found that it works just as well as the people in the US and Canada that tend to want to give it a lot at nighttime, all right? So I would tend to give it more at night. I'm sorry, in the morning to avoid the sleep disturbances at night, okay? All right, then to the second part of your question. So Zanetta, again, the key with naltrexone, make sure you give it a long enough try to see if it's going to make a difference for you, okay? It's interesting, too, there's some evidence that it might even help in something called mast cell activation syndrome. So mast cells that get too active and give you mast cell activation syndrome, they have receptors on them for endorphins, it looks like, too. And so we can regulate the endorphin receptors on those cells as well, too. I'm probably going to be re-updating my mast cell activation syndrome chapter to reflect that. This is something new I learned at a conference a couple of weeks ago that had part of the conference was on low-dose naltrexone. Okay, all right. All right, now in terms of Lyme and Babesia, Zanetta, I don't know who you're seeing up there right now, but in terms of Babesia, herbally, you might want to try a combination of the cryptolepis as well as the artemisinin together, okay? I'm not sure if, I can't disclose anything I know about the care that you had before, so unfortunately. But I do think that combination might be a nice combination for you. Take a look at my article on Babesia treatment, and I would follow the directions for both the artemisinin and the crypto and use those at the same time. In terms of Lyme, I don't know if I think you may be familiar with the Otoba and the Cascal. Take a look at that as options to treat those infections if you're not getting help from some of the people you've been seeing up there as well, too. Okay? All right. And good luck to you. And nice to see you here again, too. Let's see here. Hello, Ann. Let's see. Hi, Dr. Marty. Can you weigh in? I hope so. We'll see if I can. Let's see. Do I have Lyme or not? I'm 99% sure I do now, but it took my doctor and myself a long time to come to this conclusion. I have had severe pain and inflammation that can migrate and ebb and flow. Been stuck in right hand and right foot for over a year now. On crutches, here we go. However, do not have a lot of the issues other Lyme patients have. Had mold and got rid of that and parasites and old viruses, etc. Those have all been dealt with. Been doing phosphatidylcholine, IVs, and now finally some of the Lyme markers are showing up. For most recent order to earlier dates, on May 23rd, 2018, Lyme Western blot abnormal. IgM, CDC was, okay, by CDC standards, your IgM Western blot was positive. And you were positive on 41, 39, 34, 31, 23, and your IgG was not positive by CDC standards. Let's see. The only band present on Western blot was IgM P23 on 5-1. Okay, all right, let me go back here, see if there's more here. Let's see, 5-17 Lyme disease antibody, IgM blot band 23 and 41 were reactive. So I would have called that a positive test back in May 17th of 2017. Also at this test date, my immunoglobulin M was 1,271. Igenics test negative except for equivocal to Babesia decani. May not have now. Okay. Your CD57 was low at that time. Fibrinogen 755. Let's see. My CRP at 28 and SED rate 70 continue to be sky high. I'm super fit and eat clean. Can't get those to lower. All right. So I think here's the last part of your question. Okay. Currently, my doctor put me on 6 weeks of minocycline 2 times a day, and beyond balance, CBB1 herbal tinctures. Do you think this is Lyme? How should I treat? I'm thinking I should be on Japanese knotweed, weed, or CSA formula. Thoughts, please. All right. All right. That's a lot of information you gave there. So let me just say, I do think from what you've just described, probably it's Lyme. Okay. As I mentioned earlier in the webinar tonight, one of the symptoms that Horowitz is finding that seems to be very peculiar for Lyme and even specific for Lyme is this wandering symptoms of wandering joint pain, wandering muscle pain, wandering nerve pain. Anything that wanders, you start thinking about Lyme, okay? Your IgM Western blot was positive. Now, sometimes what will happen is when you first have an illness, due to immune suppression, you're going to come up with negative Western blots. And sometimes as you treat a person by getting rid of other things that might suppress the immune system, you'll start having an immune system that's more reactive, okay? Now, the IgM Western blot, many doctors think that it is a false positive when it comes back after you've had Lyme for a long time, okay? So keep in mind, when we make antibodies in our body, there's two kinds of antibodies we make. We make IgM antibodies and IgG antibodies, all right? IgM antibodies are what are known as the acute antibody. They're what we make when we first get sick against a germ. And in general, they're supposed to go away. Okay, so that's the tricky part here. If you've had Lyme in you for more than a year and you're still making IgMs, you're not supposed to be making them anymore. They're supposed to have been gone by now, okay? Because usually IgM antibodies in an infection will go away by around 3 months or so, 3 to 6 months, okay? All right. Now, in Lyme disease, though, I got to tell you, in my practice, 80% of the time I diagnose Lyme is based on an IgM being positive in somebody that I think has had the illness for more than a year, all right? Now, a lot of doctors will just say automatically that's got to be a false positive test. There's no way you can keep making IgMs, all right? So we have some theories as to why it happens, and I happen to be in the school of thought that doesn't think it's a false positive. I think it's real, okay? And so what may be happening, there's a known phenomenon that happens in Lyme, which is called epitope switching. And what happens in this is what a germ covering is a layer of fat into which various different kinds of proteins are stuck, okay? So that's any germ covering, and that's the same with Lyme. Now in Lyme has the ability to move its proteins around. That's called epitope switching. So each of these types of proteins that Lyme has looks different than the other type. And then if these different types that sit side by side move to the other side, that changes what the germ looks like, okay? So what we think happens then is we think that due to epitope switching, the germ is always changing what it looks like, and that the immune system gets tricked into thinking it's seeing a new infection and keeps making the new infection antibodies, okay? So it keeps manufacturing the IgM antibodies, all right? So in fact, I don't think it's a false positive when that happens. I think it's a true positive, okay? So you've got wandering symptoms and you have this positive IgM Western blot. I think based on that. Now, I would ask if you came to see me in person or if we did a consult visit, I would ask you a lot more questions to help figure out if there is Lyme. But just based on those two things, I think there's a good chance, okay? Now, the problem with your treatment, your doctor is not doing anything that's helpful for the cyst form of Lyme, all right? So minocycline is an intracellular antibiotic that gets inside of cells. And the spirochete form, so Lyme, as I mentioned earlier tonight, exists in 3 forms. It exists as a spirochete, that's the thing that looks like a corkscrew. It lives inside of cells, we call that intracellular Lyme. And then there's a microscopic cyst form of the germ too, okay? And the minocycline is good at getting inside of cells. So it gets inside spirochete, which is a cell, and it gets inside of cells, okay? And so it can work on 2 forms of the germ, but you're not doing anything for the 3rd form. And the MCBBB1 is basically supports your immune system. It's not doing a good job of directly killing either, okay? So what I would probably add to this regimen is I would add some grapefruit seed extract to 250 milligram pill twice a day. Grapefruit seed extract is a good cyst killer, okay? All right. I would also get on something to lower cytokines. Now, you can either do that with the Japanese knotweed, or you can do that with curcumin, which is my favorite way of lowering cytokines. And that's to do curcumin. I like using a Thorn product, which is a liposomal curcumin called Mariva 500, and I would do that as 1 pill 3 times a day, okay? The other thing I suggest that you do, Ann, is take a look at my treatment protocol. Make sure you're following the steps that I mentioned in there to help get enough sleep, to lower cytokines, to boost your adrenals, walk through that whole protocol. You'll see steps that I say that you need to address, okay? And I don't think that from what you've just laid out here, you're addressing enough of those. All right? All right. Good luck to you, and thank you for that question. Thank you for that multiple part question. Yeah. Bear with me here, everyone. I just got to clean out these pieces here. All right, let's see here. Hello, Katerina. Let's see. Dr. Ross, what is the best treatment for late-stage Lyme? Is the antibiotic going to do anything at the late point in discovery of Lyme? So Katerina, yes. Lyme can be helped even late stage. Take a look at my full Lyme disease treatment protocol where I give you options of antibiotics to use. I help you figure out which germs you have. I help you figure out ways to get sleep. Take a look at the full treatment protocol. I think that's a better way to answer your question. But the answer is yes, on average to recover from Lyme, no matter when you start treating, even if it's late stage, an average recovery takes 2 years, okay? And with treatment, up to, people can get improvements that range up to 100%. They may get 100% well, or they may only get back 50 or 60%, okay? And when you treat, no matter what the antibiotics are, the things you do to support your body, it can take time to turn the corner. There's been one research study done that shows that by 3 months of treatment, 30% of people start having improvements. By 6 months, 60% start having improvements. And by 9 months, 90% of people start having improvements. Okay? All right. Hold on, everyone. I got a cough here just a minute. All right. So, Katerina, let me just do a quick screen share again here. This is, again, the Ross Lyme Support Protocol. All right. Take a look at this whole thing. It basically tells you, how are you supposed to treat Lyme? All right. So, number one, do things to get 7 to 9 hours of sleep. I give you some herbal and prescription options here, okay? Number two, be on a paleo diet. I prefer paleo diets if you can tolerate it, okay? All right. Number three, lower inflammation cytokines that are made by the immune system. The reason you want to lower those cytokines is it will help your immune system work better and also help you feel better, okay? Number four, be on something that helps your body deal with the stress of the illness. That's ashwagandha. Number five, figure out, do you have any problems with hormonal issues and fix them. Number six, be on a good multivitamin. Number seven, do detox support. And I like using glutathione to help with that, okay? Number eight, do exercise to tolerance if you can. All right. Number 10, deal with yeast if it's in you, and I tell you how to figure that out here. Number 11, treat your Lyme infection. Number 12, treat your co-infections, okay? So I walk through steps. I even tell you what herbs or prescriptions to use here. This is a full Lyme disease treatment protocol. Take a look at it. I think it'll give you the information that you need, okay? Let's see. Hello, Dr. Ross. I have a son with autism spectrum disorder, and I think that he might be infected with Lyme. He has severe OCD, and I suspect that could be part to blame. What's your take on OCD and Lyme? Thanks. So Lyme can give OCD. Bartonella can give OCD. Lyme can be part of autism spectrum disorder, and some people it might be the cause, or it's a contributing factor. Bartonella can be too. So I would consider treating for both Bartonella and Lyme, or at least seeing by testing if they're part of the problem, okay? All right. That is, I would test for Lyme. Bartonella, you kind of got to decide based on symptoms if it might be the problem, because testing is not that good, okay? All right. Listen, everyone, I mentioned earlier tonight that this has been a long day. I actually, unfortunately, had to work right up to the beginning of the webinar. I think I'm going to call it quits for tonight. I'm going to go home and take care of these two Basenjis here that are kind of glaring at me for not getting them out enough today, and get them walked. And I'm going to go ahead and walk myself, too, and get some dinner in. So I'm going to call it quits for tonight. For those of you that are from Europe, I just want to make a quick comment. So I know right now it's hard to sign in to my webinars because of the new European privacy guidelines. The webinar platform that I use, I need to upgrade to a different version of it to start taking those people that want to sign up from Europe. Until I do so, because next week's webinar, I don't have it, it won't be set up. Until July, if you do want to sign up for the webinar, reach out to me directly at my email. It's docmarty@thehealingartspartnership.net, and I'll be glad to send you a link that you can get in even if you are from Europe, okay? All right. All right, so everyone, thank you for remaining here tonight, and I hope you got some good information that can help you improve from your illness. I'm going to, in a second here, as I sign out, I'm going to transfer you over to Treat Lyme. I'm looking for subscribers. If you're finding benefit from these webinars, please subscribe to the information that I have at Treat Lyme. You'll find lots of good information there. But keep in mind, when you subscribe, that actually supports my ability to keep doing these webinars, okay? So I'd appreciate if you would do that. And I'm going to take you to the page that you can do that here in a little bit. Also, I did not mention it earlier tonight, but if you're looking for a place that you can get supplements that I recommend of high quality that are really good for Lyme, take a look at my supplement site. That is Marty Ross MD Supplements. The URL for that is treatlyme.com. And I basically carry all the supplements that I mentioned here in the webinar tonight there too, okay? And then tomorrow morning at 6:30 in the morning, between 6 and 6:30 in the morning, you'll have notification in an email from me saying that the recording is ready, okay? All right. Good night, everyone. It's been good visiting with you.